This is LiveWell Talk on the C.A.R.E channel. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. St. Luke's recently installed the C.A.R.E channel on the TVs in our patient care rooms. C.A.R.E stands for Continuous Ambient Relaxation Environment, which describes the therapeutic environment provided to patients who use the program. Our guest today for this episode is Brent Rairdin, chaplain at St. Luke's, to show us how the C.A.R.E channel can benefit patients and visitors and team members. Brent, welcome.
Thank you. Appreciate the opportunity.
So this is basically like CNN at the airport, that just plays all. Tell us what it is.
So the C.A.R.E channel is professionally produced video scenes of nature images. When they produce that, they specifically go out to find scenes that will be particularly relaxing for patients without increasing anxiety. So they don't want nature scenes of a jungle scene or a lion eating a zebra or anything like that. So it's just nice, calm scenes, mountains, oceans, tropics, all of that. They also include professionally produced music that just has a soothing impact as well. One of the things I like about the channel is that it is all aimed at healthcare. The whole goal of it is to create an environment for patients that will just help them be more calm, be more relaxed, reduce anxiety.
Well, I mean, like we've presumed, I have never seen the study, but, like fish tanks and other things that you can look at are calming, which makes sense. I mean, that's just,
yeah.
I catch myself, do you have like Apple TV or Netflix or anything like that?
Netflix, yeah, sure.
And like Apple TV, like you quit watching for a while and then it goes to these like drone footage of cities. Sometimes I just watch that for a little bit, it's because it is kind of relaxing. That's interesting. Yeah. So this is just a set channel on the TV? So
it's on channel 70 in the hospital TVs.
Okay.
And the programming is on an 84-hour non-repetitive cycle, so that the likelihood of patients seeing the same scene more than once are pretty slim. The other thing that's cool about it is that it's aimed at just the daily cycle. So it starts out with sunrises. At the end of the day, it turns to more of the sunset type scenes and then goes to a star field. So the nighttime scenes are just a little bit more peaceful and relaxing to help patients fall asleep and stay asleep.
Because the hospital is a great place to get sleep deprived.
Yes, it is.
I mean, there's bells and whistles and sounds and being woken up for vital signs and all sorts of stuff. So restoring that or preserving that day-night sleep cycle is very important, particularly patients that might have a little dementia. So is it the same like in birth care as it is in surgery? Is it just one channel?
So there's actually two different channels that are available in the hospital. One is just the C.A.R.E channel, which is the channel 70, and that's just the nature scenes and the background music. There's also guided imagery available, and that's on channel 75. Now within the hospital, that's it's kind of a randomly generated, different topics come up. I think it's every 15 or 20 minutes that a patient can tune into to guide them through some relaxation. But there's also what is known as C.A.R.E Connect, and this is available to outpatients as well, and so it could get more specific for the birth care center, for pre-surgery, some of those types of situations, especially with the guided imagery. There's also like children's programming for the guided imagery, so just to help them relax, that's aimed particularly at children. So there's a wide variety of things that are available that meet more specific needs.
Wow, that's really cool. I've often thought it would be kind of cool if we had like a channel that kind of went through like, okay, you're going to get your blood drawn, and here's what's going to happen. Here's the person that's phlebotomist that's going to come to your room, and this is why they put a tourniquet on you. Stuff that I think that would help patients' anxiety to kind of see the behind the scenes, and so this is kind of in that same sort of mold, if you will, to use some imagery and the television and to get people to relax. And we want them to go home, but we want them to be happy and feel safe while they're here.
Well, I don't think there's going to be anything that shows a tourniquet being put on.
Well, that's right. You did make that.
Yeah, it's one of the recommendations that they have though is to put this on during procedures, during some of that, so that the patient can have something else to focus on, so that, if you're uncomfortable with getting stuck with a needle, here's a little bit of a distraction so you don't even know that it's going on.
Kind of like in the 70s when the dentist put in the ceiling tiles,
Yes.
right?
Yep.
So,
Yep.
yeah. So you're a chaplain here at St. Luke's.
Yes.
I've certainly seen you in the hallways and exchanged greetings. Tell me about you.
Well, I have been a chaplain here at St. Luke's for the last 2.5 years. I was a photographer for 30 years before that, and decided to go into chaplaincy, and I've never looked back. Really enjoy the work that I do here in the hospital. Just recently stepped into the role of coordinator and educator for the department, and just enjoying more of the educational aspects that go along, and mentoring and that as well.
I think like I was a volunteer here, like in 8th grade, so that would be 1980 or somewhere in there. And as a little kid, it's nice to see the chaplaincy starting to have a more visible role in the last 10 years. Palliative care with hospice, just ethics committee, because I think that's important.
Yeah, and one of the things that we've been focusing on lately, which the C.A.R.E channel helped kind of evolved out of that, is just more of a focus on diversity and inclusivity. Most people think of chaplaincy as being primarily about a particular religion or prayer, those types of things. But we're really much more than that. How the C.A.R.E channel kind of evolved was we used to broadcast a Sunday service. Right, and we really started to call into question, we were just meeting a very small piece of the patient population with that. And we were looking for a way to be more inclusive, more diverse, actually something that was less religious and more calming. Chaplains are there for a non-anxious presence in patient rooms. And so this is just a natural outreach of that, kind of a spiritual holding of the hand of patients when nobody else is in the room.
Yeah. Well, we should use technology to our benefit, and if that is
absolutely
can work. So, hey, this I really enjoyed learning about the C.A.R.E channel, and I'm sure we'll see it on occasionally as we make our patient care rounds, and exciting stuff, Brent. And thank you for being on the podcast once again. That is Brent Rairdin. He is St. Luke's chaplain, and now you're director of education. You said for the chaplaincy.
Educator and coordinator.
Educator and coordinator. I want to get that right. I want to have the whole title.
I can never get it right either,
all right. Sharing more about the C.A.R.E channel. For more information about all services provided by St. Luke's, visit unitypoint.org. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.